Hello everyone, this is Tanvi Joshi from Vantage Research. This video is a walkthrough of the poster using a QSP model of rheumatoid arthritis calibrated to capture clinical response to Adalimumab to perform population analysis. This poster is developed by Vantage Research. Rheumatoid arthritis or RA is an autoimmune disease that causes inflammation of the joints. A variety of DMARDs, that is disease-modifying anti-rheumatic drugs, are primary treatment for RA and show a wide range of response among patients. This makes it necessary to determine biomarkers that can predict response and help identify best treatment strategies for the patient. We have developed a QSP model that captures the pathophysiology of RA along with three standard therapies, methotrexate, adalimumab, and tocilizumab. We then generated a virtual population and analyzed patient characteristics based on therapy response. The model is a system of ODs that captures the key interactions between cells like FLS, CD3 T cells, macrophages, B cells, and cytokines like TNF alpha, IL-6, TGF-beta, and so on. The model is parameterized using data from published in vitro studies and clinical trials. WED-021 modeled as a function of the key cell type defines disease severity and response to treatment. The model is calibrated to three standard therapies, methotrexate, adalimumab, and tocilizumab. The PK models for these drugs are derived from published POP-PK studies. To generate a virtual population, we perform the following steps. We begin by identifying important parameters based on model sensitivity and biological knowledge. The parameter space is then sampled to generate a virtual cohort with a large number of virtual subjects. Virtual subjects that do not satisfy the model constraints are removed from the virtual cohort, and the filtered cohort is used to create a virtual population that fits the trial data. As seen from the figure, the response of the virtual population, shown by yellow bars, falls within the 95% confidence interval for all three therapies, shown by the orange bars. Once such a virtual population is created, we can analyze model species to determine characteristics that distinguish responders from non-responders. For the analysis shown here, we refer to Kim et al., which postulated that the angiogenic cytokine vascular endothelial growth factor or VEGF could be an alternate biomarker for assessing disease severity and treatment response. Please note that we only intend to match the trends and not the actual values. This is because the model reports tissue concentrations and the data reports serum concentrations. Following are some of the key results. Disease severity score WED-028 correlates with baseline levels of tissue VEGF with a correlation coefficient of 0.7 and p-value less than 0.001. This is in agreement to what is reported in the data. Secondly, the responders to methotrexate, adalimumab, and tocilizumab show a higher drop in VEGF concentration compared to the non-responders. As evident from the tables below, the mean change in the VEGF levels in the responder category is significantly higher compared to the non-responder category. Lastly, delta VEGF, that is change in VEGF levels with therapy, positively correlates with delta DAS in all three treatment groups. However, delta IL-6 shows a positive correlation with delta DAS in only the methotrexate and adalimumab users, but shows a strong negative correlation in the TCZ users, where TCZ is an antibody against the IL-6 receptor. These results show that our model agrees with the results from Kim et al. And predicts that the tissue VEGF concentrations can help in determining disease severity and distinguish responders from non-responders in all three treatment groups. In summary, the Vantage RA QSP model captures the pathophysiology of RA necessary to fit a virtual population to three standard therapies. The calibrated population also shows a strong correlation between WED-028 and VEGF at baseline and post-therapy. The model can be used to simulate alternate dose regimens of existing drugs and test new drugs targeting the calibrated pathways. We're planning to publish this work for peer review and communication, as well as to continue to expand it further by calibrating to other BDMARDs and JAK inhibitors. Thank you for your attention, and please do join us on November 11 from 9 to 9:30 a.m. EST for a Q&A session.